morning, good afternoon for some folks joining from different time zones. Before we get started, I just actually want to acknowledge how special this is that we have, I'm seeing 83 people from all over the world who care about this subject, who are in solidarity with Haiti and Haitian health workers. And I think that's like really incredible because I'm not sure I've ever, at least not recently, been in a space with 86 other people all similarly absolutely committed with our full hearts to this topic. So this is really special, and I hope we can continue to do it. So with that, good morning. I'm Adeline Azrack with Fondation CHANEL. I'm also a board member of Volatile, Schweitzer, and a great fan of all four of the organizations speaking today. Just to kind of get us started a little bit, because we want to make as much time as possible for the speakers, I wanted to just acknowledge that we all 89 of us, need to really work together to keep our eyes on this topic and what is happening in Haiti. There are crises everywhere in the world right now that are heart-wrenching and very difficult to process. And so there's a lot of competition for our attention and for our emotional energy. And Haiti needs to be kept at the forefront of our minds. It is in our backyard. If you are American or European, it is, we are intertwined in our history. European countries and the United States have done a lot to both create the situation in Haiti and perpetuate it. And there is a lot that we can be doing differently, but the same old behavior is not going to change the situation. New solutions are needed and new kinds of solidarity are needed. So I think this is another moment to reset and say, okay, what are we going to do differently? Because the same behavior is not going to continue to, it's only going to continue to produce the same results. So we have a duty to stay present and not repeat the mistakes of the past. And another thing I just kind of wanted to pause and acknowledge is life goes on in Haiti. Just as if you're American, we are not our politicians and we are not our political crisis. Haitians, everyday, ordinary human beings are not the political crisis. Life goes on. Children are going to school or doing their best to go to school. Couples are getting married and having children. People are going to work to the best of their ability. They're farming, they're starting their businesses. Life is going on to a great extent. And we need to keep our focus not just on the political crisis, but on the everyday acts of ordinary life and joy and resilience. And that's where we can show up. So the last time we met, we surfaced 4 recommendations. I'm going to list them very briefly now. And I'm thinking just as a warm-up, as we start to do some introductions, I would love to see in the chat whether you and your family organization, you personally, your foundation that you work for, whether you found ways to follow up on any of these recommendations, and if so, how, just to share with each other a little bit in the chat. So the first recommendation we had the last time was to fund networks. Map networks of organizations in Haiti across sectors that you care about and fund across the network, because networks are stronger and more resilient than individual institutions alone. Second, fund agility. Haitian organizations need maximum agility. They know the solutions, they know what they need, they know how to get the job done, don't get in their way. Fund agility. That means de-restrict your grants, make your funding as flexible as possible, reduce paperwork, reduce administrative burden, smooth things out as much as possible so that Haitian organizations can focus on their work and not focus on their donors. Number 3, fund predictably. If you can give a multi-year grant instead of a single-year grant, you have just massively reduced friction and stress for organizations. Have conversations really early in terms of when your grant is ending. So don't leave people guessing. If you can start to have conversations, if your grant is ending in 6 months or your funding is ending in 6 months, make commitments early so that, again, organizations don't have to chase you around. And finally, think about health workers, not just the patients. Think about the health workers. The actual infrastructure of Haiti's healthcare are human beings. Consider how we're supporting these men and women who compose Haiti's health infrastructure. So with that, we'll be watching the chat to see what comments or thoughts you have on how you've been able to follow up on some of these recommendations. But let's start introducing our panelists. Today we have Dr. Miliane Clermont, who's the Director General of Hopital Saint Boniface. Welcome, Dr. Clermont. We have David Ellis, Executive Director of Haiti Air Ambulance. Wonderful to see you again, Dr. Ellis. And we have Jessica Laguerre, Chief Operating Officer of Hopital Albert Schweitzer, and Dr. Wesler Lambert, who is the Interim Executive Director of Zanmi. So welcome to all of you. Thank you for taking the time. My first question, and as you answer the first question, please just restate your name and the organization you work for. And then the question is, briefly, how have things changed for you and your institution since we last met 6 months ago? What's getting better? What's getting worse? So why don't we start with Dr. Clermont.
Good morning. I am Miliane Clermont. I am the General Director for Saint Boniface Hospital in the south of Haiti. That crisis started several months ago, and over the 10 months, the crisis is worsened. The security situation gets worse in the south road, and there are more gangs on the road from Port-au-Prince to the south region. And it was very bad from December to February because some more gangs wanted to be installed. Nowadays, as they feel they are stable, they are less dangerous, but they are asking people to pay at several points of the road. And then access to good and medicine is very bad now. And this was at the end of February. Pharmaceutical laboratories, warehouses, and drugstore loaded in Port-au-Prince. Then the crisis get worse because people have to pay at several points, and goods and med supplies become very rare in the south for now. Thank you.
Thank you, Dr. Clermont. And how about we move on to Jessica?
Good morning again, everyone, and thank you so much for having me on this morning and for connecting all of us in these difficult times. For us at HAS and the Altibonite, I want to say, since we last spoke, similar to what Dr. Clermont shared, is that we're having challenges in terms of sourcing resources, drugs and pharmaceuticals, and also things for regular operations like fuel is becoming extremely hard. I think we know that the vast majority of the gang violence is in the West Department and in Port-au-Prince specifically, but right after Port-au-Prince, it's the Altibonite, and we're right in that area where there is a spike and increase in gang violence. So we continue to deal with security challenges of our area, but also with just access to resources, and not just us as an institution, we're seeing it for the population in general. Food insecurity in the Altibonite has been, I want to say, labeled level 4 for the World Food Program. It's an emergency situation now for food insecurity, which is heartbreaking. For those of you who are well informed about Haiti and the profile of the Altibonite, this is supposed to be the food basket of the country. But we're at the highest level for food insecurity right now due to the gang violence and the crippling of regular activities and, decrease economic power of families in our area. So they may be farming rice, but they don't have anything else to go with the rice, right? So that's something that we're seeing in terms of the patient too. We're screening for increased case of malnutrition in our service area, especially for children. There are complications, a lot more complications with pregnancies we're seeing. And also the patients just don't have the buying power for care in a lot of ways. If that's the proper way to say it. we're seeing that people, you know, we are big on education and awareness, especially in our community health division, in the field work that we do with our community health workers. But we're preaching best practices, but what we're seeing is families just cannot afford the best practices right now. So that's just, you know, trickling down, whether it's with WASH, with malnutrition prevention, prenatal care, at all level of care. We're seeing the direct impact of this crisis on patients, their livelihood. And also we're worried about what that means long-term, because I know we often speak about the security challenges now, but there is another monster waiting for us once we get through this security hurdle, which is long-term care and quality of life for people. So for us, those have been the biggest challenges. In terms of what had improved, I want to say since we last spoke, on our last webinar, we really all focused on the brain drain and the challenges with staffing. I think for the past couple 6 months, there's been a little bit of we've stabilized that for us at HAS. So we were able to recruit specialists, and we've been able to hold on to our new recruits and new hires. And we feel like our services for the most part have stabilized in terms of staffing capacity. So we're very grateful for that.
It's enormous. It's wonderful, just holding on to people and making this job something that people can also create stability in their own lives and work. How about you, Dr. Lambert?
Yeah, thanks everyone. Good morning, and this is a pleasure for me to be part of this panel with these great people, you know, with these heroes. I call you heroes because what you guys, you know, have been doing at Health Equity International, at HAS and IT Ambulance, this is phenomenal in this difficult environment of Haiti in general. What we are doing, we have to you have to keep to give yourself full credits and your staff for all this. What have changed? Lots of change have changed for us at Zanmi Lasante. I'm the Zanmi Lasante is operating mostly health facilities in the central region of Haiti, where our main warehouse is located in Port-au-Prince. So we can imagine, the impact that can have on our operations. So we can't move staff and stuff around. Like even before the situation got worse, we used to have our staff. We had to fly our staff to Cap-Haïtien and get them driven down south to the Central Plateau. So you can imagine that have huge impact on cost of our operations. I will say double, triple, the budget of our transportation operation. Fuel is another item that we are paying more and more. But let's go back to the core. It has huge impact on our staff. You know, our staff morale have been very challenged and affected by the crisis because just for your information, we are operating clinics in the central region, whereas most of the staff, the clinical staff, they have their parents, their family living in Port-au-Prince or in other parts of the country. They can see them, they cannot see them. And also that's affect our rotation because we have staff. We can rotate our staff. So it is the same over the last few weeks. It's the same staff that have been working at the site. So it has huge impact on our staff mental health. And also our staff, they have fear for their own security. You probably aware that nearby hospital have been attacked in September 23, and then there is this fear from other side that the same thing can happen again. Huge impact on our patients as they can't move around. It's difficult for them to not only to pay transportation as to the point by my colleague from HAS, but it's also they can't move around. Sometimes roads are blocked. They can't get access to the health facilities. Yet in the Central Plateau per se, we don't have that level of violence compared to the Port-au-Prince area and the Artibonite, where HAS is operating, but it has impact on 1/3 of our patients come from the western region. So these are like, it has complete, they have, this crisis has forced us to move our main office from Santo, where there is a gang. It's like Santo 18, where we have like, it's plagued by gangs. We have to move our main office to Pétionville. So it has huge impact on people, on staff, and the cost of operations overall.
Thank you, Dr. Lambert. And then speaking of trying to find innovative and different ways of getting people and supplies places, David, what are you seeing that's different, changing, staying the same?
Yeah, thank you all for allowing me to be here. It's great to be on the screen with three of our fantastic partners. I think, just looking back over the past year, I think all of us have really realized how essential collaboration is, that we all have different solutions for each other, different problems, and I think all of us have benefited from that. I think the biggest change really for Haiti Air Ambulance has been in the realization that we need to pivot from the strict air ambulance mission that we've had in the past, and really look at the resources that we do have in the country and see what's the best good that we can do with those. We've run some pretty successful programs in moving physicians, moving supplies. We did a fantastic cold chain delivery where we got some essential cold chain supplies from Miami to the on-site hospital in I think about 8 hours total. We were happy to be the last leg of that. But really the biggest piece for us is just in the change of mission. The air ambulance piece isn't going to go away, but when we look at getting the biggest bang for our buck and doing the most good that we can with the resources we have, we're pivoting to a point of trying to help the other organizations that are helping the broader population to make sure that we have a much broader impact. That's obviously affected by all the things that have already been mentioned. The cost of fuel is going up. There are difficulties in getting medical supplies, difficulties in staffing that we've all worked to overcome. But that's, I think, the message for our biggest change in the last 10 months has been the pivoting of our mission to better meet the need that we're seeing.
And the ability to, and the willingness to pivot your mission and pivot your strategies constantly is something really to be celebrated. So speaking of working in networks and connectivity, I want to start back again with Dr. Clermont. How have all of you worked in networks, either with each other, with other organizations? What opportunities do you have to work in networks better? And Dr. Clermont, I think you wanted to add a few other challenges as well, so feel free to address both questions.
Oh, okay. Thank you. Thank you very much. And we have worked together over the challenges to see how we can continue to have access to goods and medical supplies. And we have patients and supplies when time is very critical. And it's very important for us because for the last month, we are not able to move any patient who need a critical care that we can provide in the South. And it's very difficult for us because we could have the transportation that we used to receive. And another challenge that people in the South is facing, it is socioeconomic position of the population. Not even they can't make money as they used to because they have less access to goods, but we are facing a problem with cash because the banks in the South cannot have access to cash. And even if people have a certain amount of money in their bank account, or if they can receive a transfer from parents at other part of the world, they can have access to it because the central bank cannot send money from to the south for several months. And even for the hospital, we need to do a lot of trips to have access to some money, what may make us in a bad situation with providers sometimes, and specifically to have access to good on the local market.
And then Dr. Clermont, how have you been working in networks and in partnership with other organizations, and what opportunities do you see to do that differently, to do that better?
Yes, we continue our partnership with Haiti Ambulance, ZL, but we increase our partnership with other hospitals around us because we saw that partnership is the key to go through all those challenges. As we exchange medicines, we exchange medicine and supplies between us. We continue to work with the Ministry of Health we continue to do trainings that we have planned to do for other health facilities in the same alliance with us in the South. Then even if in Port-au-Prince it's critical, but in the South Department, we organize us to see how we can keep the most long-term possible to continue to provide care to the population.
Wonderful. And how about you, Jessica? I know that HAS has been doing a lot in networks and also to create and sustain networks.
Yes, Adeline, I think I want to say it's been a couple years now since we really have been working on reinforcing our networks with partner organization. I want to say going back to the early days of COVID, because there were already restrictions with supplies coming in. So ZL, Dr. Lambert and his team are great partners and great allies for us. We're kind of like about an hour and a half away from each other. So we can quickly check stock, see what we have in surplus, what they have in surplus, and kind of do an exchange or support each other that way. We were even in talks about flying our staff out of Port-au-Prince, and we were starting an initiative with a charter flight to Pignon, collectively to share a chartered plane, and have our team on board. So the work that we're doing with partner organization is critical. David and Haiti Ambulance is a key part of our mission as well. Our work, being able to transfer patients, unfortunately, we've had to reduce that with the current crisis. And, I think what we're looking to do and what's been challenging for us, I want to say, is that we have a desire to increase and broaden that network, but there are some real challenges in being able to actually connect with institutions that are further away from us, right? So I think that's something to look at, and I'm sure, David, we can figure out a way to broaden that network through Haiti Ambulance. But that's definitely something to look at. We have been supportive of local public hospitals as well. We continue to support them with like oxygen as needed in St. Mark, for example, in Verret. That's always been part of our mission. And given the current situations in Port-au-Prince, we are opening those efforts up again for more institutions in our immediate area that may be in need of oxygen. I think we're just keeping open lines, and we've really, over the past couple years and the past couple months, have tried to reinforce our relationship with leaders of local healthcare institution or immediate area, having each other's contact information to be an immediate source of response or relief if there is an issue that we can help, or if they can help us as well.
Thank you, Jessica. And over to you, Dr. Lambert.
Thank you. Our names, Partners in Health, Zanmi Lasante, it's like, it's a clear example of that we believe in partnership. And this crisis is teaching us more and more every day that we have to work together to tackle the critical needs of the population we are serving. And I'd like to particularly give a shout out to our friends and partners in this panel. Saint Boniface. why I keep calling it Saint Boniface, Haiti, Health Equity International. You know, we have personal connection with this team, and that makes it easy for us. Jessica, you know, I can't say thank you enough, because we have worked for years with we collaborate for years with HAS, and very recently we have like a strong example of this partnership where we are almost stuck out of IV fluids. You can imagine, guys, patient, you know, hundreds of patient lives were at risk. So they are, Jessica, it's not like you use all the surplus, you use for cost stock. It's not for your surplus. I have to there's an opportunity for me to acknowledge, David, you have been incredible, you know, helping us. Myself, we was talking in Port-au-Prince, and our team, we want to go to Mumbai and do some, you know, provide some support to our staff. Haiti has been incredible to us. So it just, I'm naming those examples just for you to know it's not like, it's not about like talking. It's a real example of partnership, because we have at Zanmi Lasante, we have example of these, you know, so-called partnerships, and I've experienced that after the earthquake, the 2010 earthquake, where like lots of partners, lots of money, and not that much impact. And this crisis is making it take the partnership at another level. And we are very grateful as an institution, but also on behalf of our patients and our staff, we are grateful to these great partners. This is not this is not a hazard that we are here today on this panel to be talking about partnership and our struggle, our challenges, but also our successes. We've been saving lots of lives.
And finally, David, what are your observations about networks right now?
I'm going to expand on some things that Dr. Lambert said. I think particularly the one thing that jumped out at me is that we, you know, have worked together so much now that we all have a personal stake in each institution's success. It's not, well, Health Equity International has a problem, but it's not really my problem. You know, we all have really, I've really felt that we all pull together, you know, much, not that we didn't in the past, but that, you know, we've got a much greater connection between our organizations, and that the realization that as we try to improve, sustain or improve healthcare in Haiti, that as we you know, increase each other's capabilities to support each other, that we're doing tremendous good overall for the health of everyone that we're caring for.
All right. It's really poignant to me personally to hear these stories of connection and collaboration. I think as many people here know, the fracturing and the sort of piecemeal nature of Haitian NGOs, especially international NGOs, and even public health organizations, is really one of the root causes of sort of dysfunction in the health system, and just overall in the social justice infrastructure. It's that disconnection and the territoriality of organizations historically, that sort of carving up the country into little pieces of you know, who is working where. The antidote to that hasn't worked, it's actually not served Haiti, is working in partnership. It's working in community. It's you know, everyone needs their own individual resources. This sharing of resources, social capital, intelligence, innovation is just tremendous, and it's really a beautiful thing to hear. And yes, I agree that in the years right after the earthquake, we did not see, there was a lot of collaboration on paper or through meetings, but not actual true community collaboration that we're seeing now. So that's tremendous. So what other outside the box solutions have your organizations come up with recently to deal with some of these challenges? Any out of the box solutions, but I actually wanted to also go back, Jessica, to staff retention being one of the most critical challenges. So what kinds of out of the box solutions have you all come up with? Maybe starting with Jessica.
Okay. To be honest with you, Adeline, I'm not sure that the solutions are very much out of the box at this point. I feel like we've been in this crisis for so long, And we've been adapting and preparing for this kind of like, hey, 1 month of no supply or no activity for, I want to say maybe 2 years now. So I think what may have been out of the box a few years ago is kind of like part of a routine operation and planning now. So stocking up on fuel at all time, just in case, even though there's no crisis. Ordering, if we used to place an order with our suppliers for 3 months, we're doing it for 6 months now. But even then, we're going above and beyond and planning and preparing just in case. But you always end up with the challenges, such as prior to this, you know, I want to say the past couple months of the crisis in Haiti, the security, the political crisis. Prior to that, there were 2 or 3 months where imports were practically like not happening, right? Like it was so hard to get things out of customs, or there were huge delays. So even as we're trying to get out of the box and plan a year ahead, order ahead, it seems to be that the challenges are always in the way and we can't quite beat the system in this challenge. And I think right now we have stock of maybe some items, and we're trying to figure out how to bring small stock in or small resources in. But realistically, I think we just need to really kind of like realize that at some point there's no more creativity. There's no more out of the box. There just needs to be a serious change, because we're not going to be able to do this long term. And we can keep planning, but what happens if there are no ports open for like another 3 months or 6 months, right? Like those are real things that we need to consider. I think we're going above and beyond, and we are, because this is healthcare and this is a right, and there should be healthcare in all conditions, no matter if it's war, no matter this, you know, what's going on in Haiti now. But I really just have to say, I think we're out of, at least for my institution, we're out of creative solutions because they've been embedded in our regular operations for some time now. And I mean, we were able to bring some improvement to our staffing, by listening to our staff and recruiting, having honest and transparent conversation about what can you commit to us. So whether it is from going from having one full-time pediatrician that was on campus maybe 3 out of the 4 weeks to having 2 that do a week and a half or 2 weeks, right? Having different contract format, being flexible. And most importantly, we were really going above and beyond in trying to transport and move staff around. Hence why we were looking at private charter planes. But even that, again, perfect example of creative solutions just not feasible. We did that for about a month with a small private charter company. We were flying 3 people at a time, or 6 or 9 at a time, dropping them off in Pignon and driving to HAS. But with the security situation, there is no flying out of Port-au-Prince, right? So we keep getting creative, but some way, somehow, our solutions don't seem to last very long, right? And I think that's what I mean by like, we're going to keep doing things, but there are going to be hurdles, and there needs to be a real shift and a real change in Haiti for us to continue doing this work and have the same impact. That I feel like the support that we provided with the transport, the airfare for the team to be able to at least do 1 trip, maybe once a month, to see their families or loved ones for those that are based in Port-au-Prince. We had staff that were coming from the Gonaïve or Cap Haitian. So we added like transportation options for that, maybe, you know, once a month or every 2 weeks. But really what it came down to was hearing what our employees have to say, or new recruits have to say, in terms of what they can commit to, and understanding that there are some people that just were not able to commit to HAS right now due to their personal reasons, and accepting that. But at the same time, for those that were able to commit a week, how can we structure your contract for you to do 1 week a month, or maybe it's 2 weeks, or maybe 3 weeks? And for those that are full-time, how do we structure it so you get compensated for being on campus for 4 weeks, the entire full month? So
that might be the quote of the day, Jessica, that what was out of the box solutions now are just business as usual. And sometimes common sense is trumps the out of the box solutions. How about you, Dr. Clermont? Any I don't want to say out of the box anymore, any interesting solutions that you've come up with, particularly around staffing, supplies, and the other challenges that you've noted that are working for you right now?
Yes, as Jessica have said, it's not easy. We really are trying to adapt us to the situation. But one thing that we keep very hard on it is our community health component. Because in those crisis period, it's very important to continue with the community health activity, whatever the cause it is, because we want to do it to prevent burden to the hospital. And then everyone we can do to keep those activities for vaccination, for nutrition awareness campaign, for nutrition care for the children, we are doing it. And we are trying to see if we can continue to have access to fuel the longest possible. And we know it's cost a lot for us. Hopefully, we had improved our oxygen production system. Then now we are more independent, and we can save some things to have access to meds and supplies. We are continuing to work with our partners in the South to see how we can help each other and to reinforce our referral system between the South. And for the staff, it's very hard to do it. Hopefully, we have more staff coming from the South, even if the inflation costs for them. But at least most of the staff can see their family, but we have nurses and doctors stuck in the South for at least 2 months and they can't see their families. What we are trying to do is to see if we can put them in a situation where they can share their concern between us with our group, with our psychosocial team, to see how they can approach this situation without a lot of too much burnout and stuff like that.
Thank you, Dr. Clermont. And how about that Zanmi Lasante, Dr. Lambert?
Yeah, I like Jessica's statement about, can we talk about out of the box solution? Now, those things that could be unusual becomes usual. And we're running out of solutions. We keep trying every day with different type of solutions to address crisis. But let me name a couple of solutions, like for staff payment and also payment of providers that we do business with. We use more and more online payment, so that reduce the the circulation of cash that have been very helpful. Even our staff is being paid online. Unlike the South, they have more difficulty to get access to cash, but in the Central Plateau, the central bank manage with the local bank to provide more cash. So we do use online more and more. We are using also the Dominican Republic route. We have this opportunity that our partners maybe like Haiti Health International, Health Equity International doesn't have, because we are close to the border. We recently used that route to get several of our containers of drugs and other stuff to that route, and we are exploring to see how we can make it more usual. But we are pretty grateful to their, it's not easy to work with DR, but we managed to get our stuff through that well. Also the idea, I think it's our partners also. I know HAS is doing it, but it's we learn from previous experience, and we have we have stock about 3-4 months of drugs and other stuff too. It's same for the fuel. That's why we're able to keep up at some point for weeks. But when it comes back to your point, Jessica, after 3 months and we can't get stuff in, then we are running out of solutions. we also learn more and more about providing distance support, like mental health support to our staff, because we don't, even we do recently implement having on-site mental health support with our psychologists and our social worker, but we're using more and more some distance support. But we also increase, which is like part of our strategy, but we have increased and improved lodging and food for our staff because we have dozens of them. They are not from the location where they are working. So there's I can add like a long list of like how do we transport our goods, because we found a way after weeks how to use like some public provider to get through the gangs control area. So yeah, we have managed to keep our facility functional so far.
Thank you. And then over to you, David.
Sure. I think really the impact for us has been the realization that we need to fortify the operation, look at anything that can stop us from doing our core business and try and improve that. And that's everything from getting our own water filtration, additional fuel that we're stocking, trying to stock up on medical supplies. But probably one of the largest impacts for Haiti Air Ambulance, as you know, we're partially Haitian staff and partially expat staff who rotates into the country periodically. And we've had 2 instances with key local staff, our chief physician and one of our operations managers, who are both extremely talented, extremely knowledgeable in the enterprise, and are really essential to our operation, who have been either burned out of their house or had to leave on motos with almost no belongings in the middle of the night. And rather than lose them as they have the opportunity to live with family elsewhere in the Caribbean, we've transferred them more to the expat model. So we still retain the talent. We bring them, we cycle them through the office in Haiti. They still obviously work from home when they're not in country, but certainly a solution that would have not even occurred to us a couple of years ago, but something to really retain that essential talent that we've had to move to.
Okay. Well, I'm hearing some really amazing solutions that I understand you need to have solution A, B, C, D, E, F, G every single day, because you might have to pivot from one to the next, to the next, to the next. But we've heard about categories of staff retention, staff mental health, staff well-being, a number of different solutions you've come up with. Supplies being one of the key issues. I've heard many different approaches to trying to get supplies through, whether it's by air or over the border from the DR, or just taking advantages of moments of peace when you can get a lot at once, but then upgrade your ability to maintain a much larger stock. Money, using electronic transfers and not just cash, and other routes that we're going to delve into a bit more in a moment. And then finally, energy independence. I do know that HAS and potentially some of the other organizations here have invested in independent energy sources, so solar energy and other renewables that, besides reducing costs for energy, are also creating more of a buffer so that your fuel can go farther. So I just wanted to hold that up. Creating some autonomy when it comes to oxygen, when it comes to water filtration, when it comes to fuel or electricity, is really key. And going back to a point you made earlier, Jessica, these are solutions that you've come up with in crisis and under enormous pressure, but that actually will serve Haitian health infrastructure and frankly just health infrastructure worldwide in the long term, because these are efficiencies and collaborations that you've created that will serve Haiti very, very well long term. We have a final question before we take some Q&A, but I know that many donors want to know how they can support right now. And what I personally would say to donors is, don't think about how you can help Haiti, because we've helped Haiti to death. Like, how are you in solidarity with Haiti? How are you in solidarity with Haitian-led solutions and Haitian-led initiatives? But we've heard concern right now that how is support that we're sending going to reach how is it going to reach the patients that you work with? I'm just going to open this up broadly to our 4 panelists. How are you ensuring that any kind of support that you are getting from international solidarity is safe and getting to the folks that need it? And is there anything that you need from us to do differently in terms of getting the resources to you in a way that enables a smooth use of that funding and a safe, stewardship of that funding? Just popcorn this, just jump right in. Jessica.
Adeline, I think for us, it really has, like, my team and I were very intentional about being transparent about the ongoing security crisis, right? So whenever we're in talks with donors or funders about sending things down, let's say if it's a container of donated materials or anything like it, we're very much early on saying, hey, we're gonna pack this, we're gonna get ready to send this down. But if for some reason there are some last minute changes on the ground here in Haiti, we're gonna ask you to hold on to this for a bit. And we've been able to do that. And we've had some great funders and donors who understood that well enough and pivot their support to say, okay, we'll hold off the container, but in the meantime, here's an immediate grant, right? Which is cash, which allows us to purchase locally, which is significantly much more expensive than what we bring in our containers, let's say, from our main supplier, Ellis. That's been key for us. Or I had another partner who suggested, okay, rather than me going through the process of packing this container of syringes, sending it down to you, and then paying this like crazy amount for custom and transport to get it safely to Deschapelles, how about you source some local options and present me a couple quotes? I think those are the type of things that we've seen in the past couple months that have been amazing and key to our operation. And also the biggest one being unrestricted funding, like you mentioned, Adeline. There are additional expenses in all, like from all areas, whether it's security, whether it's fuel, whether it's compensation or salaries of the staff, like the basics that we need for fuel. I think that's been key in being able to receive that kind of funding. And last time we discussed a bit about trust-based funding, making that donation and letting organizations decide where this money will be best used is critical and key. But I think for me, it's important to maintain full transparency and inform anyone who's considering sending a container or shipments or goods down about the situation as it is, that we feel comfortable whenever things are better, we feel comfortable saying, hey, let's send this down, but let's just be mindful that there may be a change in transit. Right before the port shut down in Port-au-Prince, I had a container with Seaboard on its way to Haiti, so they had to dock it in Jamaica. Right. And we're going back to the donor and saying, hey, I have a container. It's going to get to us, but it's going to be delayed now. Right. And just counting on their understanding and support in this difficult time is key. And I know we talk about the challenges, but I also want to highlight how amazing it is and the support that we've been receiving, and also the level of understanding. And we mentioned donor fatigue a lot, but there are a lot of great organizations that have been rallying and supporting our efforts more in this crisis. And I think that's important to highlight.
Yeah, I will second that with you, Jessica, as well. We hear, fortunately, I'm not experienced, we hear of episodes of donor fatigue where organizations are decreasing their amount of funding because of the instability. We've been very thankful that we've had a number of organizations, and as I scroll through the attendees list here, I'm very thrilled to see several of them on the call. So thank you very much. That out of cycle, out of budget have realized specific needs that we have in operating here, and the additional effort that has to be put in that have really stepped up to the plate, and it's been extremely helpful, and we're very grateful for that.
I'd like to add to the points made by David and Jessica. We do understand we also have experienced donor fatigue recently, but the months or years in the past, but we've seen a bit more, they are coming back, with more, they're expressing more their solidarity. But I'd like to make a call for these, not even for Zanmi Lasante or partners, but for these three organizations here, because there's we know, let's speak frankly, we know there is a lack of trust on Haiti in general. But these organizations on the panels today, they have a record. You know, donors can see the outcomes of their support. They can see that. It's not like the money goes somewhere. These organizations are saving lives in a time where most organizations left the country or like reduced completely their operations. They are there to stay. They have been there for years, and they are there for more time. So I'd like to make that call. I know it's difficult to come down and see yourself, but you can look at these organizations record to see that the money is being sent. The money is serving those it was expected to serve. This is also an opportunity for me on behalf of Zanmi Lasante Partners there to thank the thousands of donors that keep pouring their support to our operation in Haiti and elsewhere, especially now that many people many folks, institutions in the international community are losing faith about Haiti. Haiti is not Port-au-Prince. Haiti is more than just Port-au-Prince. So they are serious. There are people in Haiti that you can trust that will take your support to the real need of those in despair. Thank you.
Okay, from my side, I would say that add on all Dr. Lambert, Jessica, and David said, that where we are in rural area, we feel your support, and your support is reaching us. And it's what we are able to provide care 24 hours a day, all day in the week. Then we are very grateful for your support, and it's allow us the possibility to be flexible, to adapt our ways, to have access to supplies and provide care, quality of care, specifically in the South where we are, because we are a well hospital who is functioning 24 hours. And people, at least they know they can find a staff ready to serve them. Thank you for that. And I think, as Dr. Lambert said, it's not just our region or our hospital, it's a Haiti matter. And now the crisis is not political anymore. It's mostly an humanitarian crisis. And we need whatever you can help, whatever the support you can provide with resources, it's good, and we need that. But we need to have Haiti problems around the world that they know we have a humanitarian crisis. And if you can help to do advocacy for now, because we don't know what will happen in the coming months, if we'll have access to food, if we continue to have access to fuel, to continue to provide care. Thank you very much for all your support. And as we are doing the possible we can to use your support for saving lives here. Thank you very much.
I'm going to try to recap. This is impossible to try to recap a couple of the key points that I've heard. So forgive me if I missed something. But what I've heard loud and clear, to add to the recommendations of our last webinar, which remain relevant, is first of all, trust Haitian health administrators, trust Haitian health leaders, trust Haitian health workers. They know the solutions, and the best solutions are found by the people closest to the issues. Your money, if you are a donor, will reach the community. You need to trust that these organizations know how to keep the money safe and get it into the country in small bits when it's safe and however it's safe to do so, and that they have the solutions, or at least the best possible solutions to challenges that they're facing. So that's that trust-based funding. Prevention has never been more important. I'm sure that everyone here is absolutely committed to public health and to preventive healthcare. It's never been more important. So let's continue to invest in that full continuum of care and keep asking how we can do more on the preventive side. Hire local, buy local, keep things local as much as possible. And it's a double win because then you're continuing to do what you can to support the local economy. So increasingly having health workers come from the local community. We've learned a lot about, of course, expatriate support is always incredibly valuable and helpful. And we've also seen how self-sustaining organizations in Haiti can be, and seeing organizations that were once largely expatriate now become almost entirely Haitian-led and only for the better. And I think that goes for boards as well, that seeing a greater Haitian leadership in boards is only going to help institutions be more accountable to local solutions and local populations. And then finally, advocacy. I think all of us, whether it's our panelists today who've just done an incredible job advocating for Haitian health infrastructure, and the 127 or so people that we've had on this call, we all have a role to play in advocating for all of these recommendations and advocating for keeping a focus on what is happening in Haiti, and remembering that Haiti is not just it's politics, it's ordinary everyday people. So those are some of our calls to action. I know that we had many other questions that we were not able to answer, but I would encourage everybody to reach out individually to Jessica, to David, to Miliane, and to Wesler, and to ask them questions and follow up. Thank you all for participating, and especially to Health Equity International for kind of convening us all together today. And hope to see everyone again, and possibly I would take your recommendations for additional organizations we should invite into this conversation, maybe 6 months down the line. Bon courage and bonne continuation.
Thank you all very much.
Thank you, everyone.
Thank you.
Thank you, everyone.